So welcome again to the next part of this presentation, where I left you with the question, vitamin D, are you getting enough? Now in this section, we will understand the dosages and also how deficient all of us truly are and how the global standards for the recommended daily allowances of vitamin D are absolutely just not enough. But here's the background science for it. So vitamin D deficiency is now recognized as a global pandemic. Yes, my friends, it is a pandemic. But before we begin or go into the actual presentation, here's a little, fun slide to, cheer us. The darkness of space is starting to really depress me. And so our Lord Sun comes by and says, you just need some vitamin D to cheer you up. So here's the pictorial graphic representation of how deficient all of us are across India, because we are in India. And although we have a very hot and humid and a temperate climate, and we are actually quite close to the tropics or the equator as we know, and we have sun all through the year in India. And we believe that all of us do get out, up and about. We do our walks or we do our daily course and we get sufficient sunlight. And being a hot country, we actually shy away from the sun, and we do wear extensive clothing to safeguard ourselves from that extreme heat that we experience in so many parts of India. But in this representation or in this survey, we discovered when vitamin D was tested as a pool group. It's a random sampling pool group of a average which was done, and we discovered that in north of India, like let's say something like Delhi, where adults in the urban population 76% were D deficient. In the rural population, about 70% were deficient. Pregnant women were deficient by 96% of the population was deficient. Children, 93% of the average population was deficient. Elderlies, 97% were deficient of vitamin D. And this is a metro city where most of us are actually so-called educated. And we have been taught about these things and the background sciences, and we are availed with the best of the best medical facilities. Let's look at another metro city like Bombay, and 70% of adults are deficient. Even down south like Mysore or Tirupati, and urban population is approximately 88% of the population in the metros is deficient, 82% in the rural population is deficient. And this is not a pretty picture. So this now tells you how vitamin D is actually a deficiency of vitamin D is a real pandemic. Here's another chart which explains to you about. Now this testing was done actually during the COVID times of the medical fraternity. It was discovered that a majority of the population was actually 88% of the population in the medical fraternity or the medical staff was D deficient. Below 40 ng mole is absolutely negligible. It's just enough to probably save you from rickets, but probably not even that much. The target level and what it should be above 40. I would generally always recommend staying above 60, between 60 and 100, but we will discover this on the way. So vitamin D deficiency, a pandemic which is disregarded by the healthcare system. It constitutes a major risk factor towards major diseases known in humans. Now, this graph tells us how we were not so deficient in the last couple of decades, but since the year 2000 is exactly when. So if you look at the graph from 1970s, 80s, 90s, right up till the year 2000, most of us did somehow maintain naturally a vitamin D3 level above 50. And then suddenly, I think somewhere in the year 2000 or late 90s, is when some surveys came out and a propaganda against being exposed to extreme sunlight started coming out, and we started wearing a lot of sunscreen. So just around that late 90s, year 2000, a lot of propaganda started globally in the media about how not to go out in the sun or how sun exposure can cause skin cancer. And then we started using a lot of sunscreen. We started clothing or even more aggressively where sun exposure was blocked further and further. And then the numbers just kept dwindling lower and lower. So if you look at the graph, when we reach the year 2000 and most of the population is below 30, but the horror does not really stop there. My friends, when you look at the graphs of 2020 and as recent as we are now in the year 2024, just nearing 2025, and what we see in the clinic at times, I will show you these numbers which are horrifying to look at. So why are we vitamin D deficient? Why is it so common to see D deficiency? Now, if you look at this image, this is an image from traditional India where we used to work in the fields. And if you look at the clothing of women, Indian clothing was designed to give you that 50 to 60% or even 70% body exposure while we work in the sun. But now if you look, we are always covered. This is the state of affairs in the urban part of the country, especially children, but it's not only the children. Most of us are also living a similar lifestyle, being in our home or even in our office, and we are constantly glued to our television screens or to our mobiles, and we are constantly within the air conditioning. So we hardly actually step out. And even if we do, we are actually scared of overexposure and skin rashes or skin disease or skin cancer. And so we wear sunscreen. Here's another image which explains this, how we are so excessively covered all the time. Now let's go deeper into the causes of vitamin D deficiency. Inadequate sun exposure. Sunscreen with anything above SPF 15 actually blocks more than 99% of vitamin D synthesis. Pigmented skin, if you are a tan person or a darker person, the vitamin D synthesis is actually much slower, in which case you need supplementation. Aging, a huge factor, especially post the age of 65, vitamin D synthesis slows down very drastically to an extent of almost above 70%. Our synthesis actually is slower. Winter season, again, we are away from the sun, we are not highly exposed in the sun, and that is why vitamin D is deficient. Physical agents like blocking UVR exposure, clothing, season, air pollution, cloud cover, latitude and altitude, all of these play quite an extensive role in our overall vitamin D synthesis. Decreased absorption also happens in a lot of people, especially people who have had, let's say, bowel bypass surgeries, people who have Crohn's disease, people who have celiac disease, fat and cholesterol absorption inhibitors, or people who are on these drugs which inhibit cholesterol absorption in the body. A lot of other drugs which are life-saving drugs and people need to be on them for their chronic ailments also actually deplete or block the absorption of vitamin D in the body. So continuing from the previous slide, we also have an inability, and so let's understand why are we unable to process vitamin D. Impaired production of 25-hydroxy, which is calcidiol, in the liver due to liver disease. Impaired production of 1.25 dihydroxy vitamin D, or D3 as we call it, or calcitriol, due to kidney disease. And kidney disease again is a larger population of the country, especially amongst the post 50s who are diabetics or who have underlying kidney disease or a hypoparathyroidism or oncogenic osteomalacia. They cannot really convert the D3 into its real final activated form of calcitriol. There are also a lot of genetic polymorphisms. These are seen or these can be tested, and this is also what we say as one of the factors which is responsible for vitamin D resistance, in which case such people need a much higher dose of vitamin D3. And magnesium deficiency. Yes, magnesium deficiency is a vital cofactor to activating vitamin D in our body. In fact, in this slide, I will explain to you how magnesium is the most vital mineral needed at every single junction point of D3 synthesis. If you look at the image, you will understand that D3 plus magnesium is needed to get it converted from the blood through the liver and through the kidney, and its final output product, which is right going into the vitamin D receptors. Magnesium is the most crucial cofactor of vitamin D. Why are we magnesium deficient? Because magnesium deficiency leads to vitamin D inefficiency or fundamentally deficiency. So causes of vitamin D deficiency: lack of adequate healthy sun exposure, lack of vitamin D in diet, and vegetarians, we just don't get vitamin D from any of our foods. Pollution and industrialization, inability to absorb from the intestines, inability to process vitamin D, unhealthy liver and kidney function, widespread magnesium deficiency, and genetic polymorphisms or vitamin D receptors. So over the number of years, let's say assuming from 1970s till 2020, we are actually getting less sun, less food, less cofactors, and more genetic restrictions, in a sense that they are so unreal to observe when we see patients with levels of D3 around 5, around 3, around 10. That's just not going to cut any good for your health. Now, how did we also go so deficient, and why was the global population not efficiently supplemented through the past few decades? Way back in the day, when D3 was discovered, it was predominantly discovered to be able to treat rickets. They identified that how much D3 was needed on a daily basis just to simply avoid or protect you against rickets. In 2010, Institute of Medicine recommendations, on the basis of those previous studies, was made a minimum of 400 to 600 IU per day of vitamin D. But that literally is like living on a minimum wage, which is very difficult to survive on. Only 20 ng/ml was recommended as a desired blood level to prevent rickets, not any of the other ailments which we've already discussed in previous parts of the presentation. Now this was adopted, and this became the US FDA standards, which then became the world standards. And so this is what is called as RDA, or recommended dietary allowance. Now if you look at this chart, you will understand that infants are recommended approximately 400 IU. What is IU? It is called international unit. The literal grammage conversion is 10 micrograms, which is absolutely nothing. Even if you manage to spend around 40 minutes in the sun with 60 to 70% exposure, especially if you're living in a country like India where the sunlight is abundantly available, a 45-minute sun exposure will give you as high as 20,000 IU of vitamin D. So why is the RDA recommending only 400 IU? Let's go further. In adults from that age group of 9 to 70 years, 600 IU is recommended, and adults above 70 years of age are recommended 800 IU. Pregnant and lactating women are suggested around 600 IUs, which is just not adequate. So this study over here suggests that the physiological range for the circulating D3 concentration in humans extends beyond 80 ng/ml. Why does this study suggest this? Because the study bases its overall research on what, as humans, as primates, where were our D3 levels at? They used to stay above 160. Wow, 160. If you carry a vitamin D3 level of above 160 today, your lab and your doctor is going to call you back and say you are reaching toxicity levels. But my friends, please understand, there is no upper toxicity, and there are studies now which validate this claim. Let us understand how. But then over the number of years or over the number of centuries, the modern man still fortunately had abundant skin to surface sun exposure, and our D3 levels were in that range of 120 ng/ml, which is amazing. But then comes the real modern life, the 21st century, and the new normal started being around below 40. If someone is supplementing orally vitamin D of approximately 4,000 IU, even if you manage to sustainably take a 4,000 IU daily dosage, in a matter of few months, you will be able to maintain your D3 levels to above 80, which is amazing because the lab ranges suggest 80 to 100 is a perfect balance. I mean, 100 is the outer limit in most lab reports, in which case staying around 80 is perfectly normal. Serum level of 20 ng/ml to ensure bone health is also actually inadequate. As for prevention of fractures, 40 ng/mol is a must, and this again is proven by this particular published journal. Why IOM recommendations for vitamin D are severely deficient. The abstract also mentions how the IOM recommendations for vitamin D fail in a major way on logic, on science, and on effective public health guidance. Moreover, by failing to use physiological reference, the IOM approach constitutes precisely the wrong model for development of nutritional policy. Now, this is a published journal in the American Society for Bone and Mineral Research. Another study where it suggests 20 ng-mole of vitamin D levels are suboptimal. 40 ng-mole is minimal desired level, which approximately, to maintain your blood levels at around 40 ng-mole, it needs around 9,000 IU of vitamin D intake, if it's a supplementary intake, per day to reach 40 ng-mole. In my previous part of the presentation, proved to you that if you keep your D3 levels above 60 and beyond, your health is actually going to thank you. So let's go further. Maintenance of vitamin D serum concentration of 40 ng/ml or higher reduces the risk of acute viral respiratory tract infections. All of us recently passed through the COVID times, and none of us can really forget the COVID times. It was observed by us that people who were supplementing with D3 and people who had their D3 levels above 60 or above 70, the incidence or the impact or the intensity of the viral load was actually much lower, and they could recover so much faster without any acute interventions needed. This particular chart will prove to you the inverse correlation of the decrease in health problems with the increase in vitamin D3 levels in your blood. So let's say if your blood levels are below 20, then the chances of TB, hypertension, low birth weight, heart attacks is actually much higher. If your D3 levels are below 60, the incidence of osteoporosis, fractures, influenza or epidemics, type 2 diabetes, breast cancer, pancreatic cancer, renal cancer, colon cancer are actually much higher. But if you keep your D3 levels above 80 ng/ml, you are surpassing all of these ailments, or at least there is a substantial decrease in the risk factor of developing such ailments. A vitamin D concentration of 60 to 80 ng/ml is needed to reduce cancer risk. Especially, I would want to reach out to most women through this explanatory video that if you can simply keep your D3 levels all through your life within that range of 60 to 80, which is nowhere close to toxicity, it will reduce your risk of cancers. So please supplement correctly, or take the right sun exposure, or include foods that are rich in vitamin D. So now here's a chart from different councils across the world, or different recommendation agencies from across the world, as to what is the healthy vitamin D level for health beyond the bones. In the US, there is the Vitamin D Council, the Endocrine Society. On the third aspect, I put down the testing laboratories and their recommendations. And so Vitamin D Council recommends that deficiency level is 0 to 30. Insufficiency level is now 31 to 39. So anything below 40 is insufficient. Sufficient is 40 to 80. But what we see while treatment, especially at therapeutic dosages, the least we can do is try to keep someone between that 60 to 80 range, which is the perfectly right range. I mean, and that is what the most of your labs will also recommend, 32 to 100. So we are well within reach and well within range. So let's aim for 60 to 80 range of vitamin D3 levels. Vitamin D levels, or 25 hydroxy D, deficient as per therapeutic dosages or as per what we see on a daily basis at the clinical practices. Deficiency below 50, optimal 50 to 70. Treat cancer and heart diseases around 70 to 100, and above 100 excess, but again there is an inverse correlation to your PTH. So we always inversely correlate your D3 levels with your PTH levels. Okay, what is PTH and how to calculate that inverse ratio? We will learn this in the future part of the presentation. Also, if there are many labs across the country who present the numbers in, instead of ng/ml, they present it in n-mole, which is nanomole per liter. So all that you have to do is, whatever value that you see, you have to divide that by 2.5, and that is going to be your real D3 ng/ml number. So this is what we see very commonly, even in 2023, 2024. D3 levels less than 3, D3 levels less than 8, and this is how the labs are presenting that it's all right, you're simply deficient. There needs to be a massive change in the approach of how we are approaching the D3 levels when we look at the lab reports. No observed adverse effect. This study shows that no observed adverse effect level of vitamin D. 10,000 IU per day for adults, 4,000 IU per day for young adolescents between that age group of 11 to 17, and 2000 IU for children between the age of 1 to 10, and there is no adverse side effect. This is again another value from another lab report, but this also tells you how I explained to you that 24 n mole, the lab has reported in n mole per liter. So you have to divide this number by 2.5, which would be approximately 9 or 10 or even lesser actually. So that is your real D3 level, which is very low or severely deficient. This particular study presents to us that long-term intake of up to 10,000 IU per day of vitamin D maximizes the physiologic benefits and are safe. Vitamin D synthesis of 10 to 20,000 IU per day occurs physiologically through solar UVB exposure, which literally means that if you only got anywhere between 30 to 45 minutes of sunlight exposure with 70% body exposure for sure, your body is going to automatically generate 10 to 20,000 IU. So what if you are someone who works on the streets or who rides a bike to and fro to work? So many of us in India do this on a daily basis, and so it's perfectly okay to have this because that's what your body is naturally creating. This particular graph again shows the inverse correlation of your age and how much vitamin D your body is going to generate, or how much decrease in the production starts happening once you start aging. So the decade of life, when you are around your 20s, the D3 activation or absorption is much higher. By the age of 70, the D3 absorption goes down by as high as 75%. Now, vitamin D deficiency is also directly related to obesity, age and skin, color influence, and all of these play a factor into how much vitamin D will get synthesized in your body. The studies over here suggest how obesity is associated with vitamin D deficiency, and probably because decreased bioavailability of vitamin D that is sequestered in the fat of the individuals with excess adipose tissues. Old age also reduces the capacity of UVB-induced subcutaneous synthesis of vitamin D. After equal doses of sunlight exposure, a 70-year-old person produces 75% lesser vitamin D3 than a 20-year-old. This we saw it in the previous graph also. And ethnic groups with darker skin require proportionally more sun exposure to synthesize equivalent amounts of vitamin D compared to people with lighter skin colorations. Since we know that we are actually severely D deficient, most of the population is D deficient, and we have very limited sources of vitamin D from foods. Here's a presentation which tells us that a salmon has only 794 IU. A 3-pound salmon has 794 IU. Fortified cereals have approximately 40 IU. Fortified milk, and in India, milk is not fortified with D3, but in a lot of European countries, milk is fortified with vitamin D. So 1 cup of milk is equivalent to 120 IU. Egg yolk is approximately 40 IU. So the equivalent of that, which is 10,000 IU, is what our body will thrive really, and your body will thank you for giving it that, is equivalent to approximately 100 glasses of milk. Now, none of us can drink 100 glasses of milk a day just to get sufficient vitamin D, or have 10 pieces of fish a day. Just not possible, my friend. Or you can simply have 20 to 30 minutes of correct solar exposure in a healthy body. This does not hold true for people who have liver disease, who have kidney disease, or their capacity to synthesize D is already affected. So the best way to sunbathe, exposure of approximately 70% body exposure, surface to sunlight for approximately 20 to 30 minutes between the 10:30, 11 a.m. to 2 p.m. would produce about 20,000 IUs of natural vitamin D in the next 24 hours. Since we live in the 21st century, and since it's all about making life easy, comfortable, and yet living healthily, let's introduce you to sunshine in a capsule, because we are the only age technologically who has this possibility of being able to supplement ourselves with vitamin D. So how to start supplementing? Let's understand. If your blood work, when you look at your blood work, if you see your D3 levels below 40 ng/ml, 10,000 IUs per day is the right is generally what is recommended, especially if you are supplementing not for any therapeutic reasons, it's just health benefit supplementation. 10,000 IUs per day. If your D3 levels are between that 40 to 80 ngml, 5,000 IUs per day is good to maintain those levels. And this is how we generally suggest supplementing for people whom we categorize as category A people or category A patients and category B patients. Now, category B patients are patients whose efficiency of synthesizing D3 is severely compromised and or are already suffering an autoimmune disease or a chronic lifestyle disease or a chronic pain disorder, and they need treatment, they need therapy with D3 and its cofactors. If your D3 levels are less than 10, you need a daily dosing of approximately 15,000 IUs. If your D3 levels are between 10 to 20, you will need approximately 12,500 IUs per day. If your D3 levels are between the 20 to 30 range, around 10,000 IU per day. And if your D3 levels are between 30 to 47,500 IU, it's a simple calculation, it's a simple mathematics. And 40 to 50 IU, you will need approximately 5,000. So if you calculate this, add approximately 1,000 IU per day for every 10 kg approximately. So if your weight is above 65, and reduce vice versa if your weight is below 65. And this is the bare basics of simple supplementation of D3 for healthy living. Physiological dosages for vitamin D for children is approximately 200 IU per kg per day. This particular study suggests how D3 was used, and this is something what we call as a hammer dose, but this study shows how influenza was treated with 50,000 IU of vitamin D daily for 2 to 3 days only. So let's target 50 to 60 ngml of blood levels. Not taking any vitamin D for more than 6 months, your blood levels will show values of 10 to 20 ngml. Okay. Now, when it shows 10 to 20 ngml, please understand it is just sitting there as a number, not being utilized, not being activated, and your body is not only severely deficient, it's not able to fulfill the immunomodulation function or your immune function of the body. It's not able to undertake the repair mechanism or activate the repair mechanism of the body. And D3, magnesium, and the entire B complex, all of these come together to heal or repair the body inside out. Okay, so it's just sitting there as a number if you've never supplemented, or if you have supplemented casually but you haven't supplemented with magnesium, you haven't supplemented with the right B complex, then it's just sitting there as an idle number. So this is what we also do, which is called as a vitamin D hammer, for people to start supplementing and then maintain their levels above that 60 to 80 ngml for their life. So we start with a hammer of 60,000 IU for 5 to 7 days. Okay, and thereafter 60,000 IU once a week, okay, which comes to that approximate of 8,000 to 9,000 IU per day, which is a good space to be, or around 10,000 IU daily for 3 months. And then thereof we ideally test their blood, and if everything looks right, we usually ask them to continue supplementing either 5,000 IU on a daily basis or 60,000 IU once in 15 days, looking at the half-life of D3 and the way how the supplements work. The general recommendation, taking any form of vitamin D 1,000 to 5,000 IU per day, your blood levels will always remain within that 25 to 35 range only. So most of the supplements that are available off the shelf in the market generally are in that range of 1,000 to 5,000 IU at best. In India, you will hardly find either 600 IU or 800 IU or a directly 60,000 IU vitamin D supplements. Now 60,000 IU once a week or 10,000 IU daily is the ideal maintenance dosing. Now what should be the frequency of this supplementation? Now this graph shows us that when people supplement this annually, so you went to your orthopedic doctor or your family physician, and once a year they tell you, oh, you know what, you do 60,000 IU for the next 8 weeks or 12 weeks, and then nothing. And you will be shocked that once you do that supplementation, Go back and check your blood levels exactly after 25 days, and you will find them exactly from where you started off at, because the body either utilizes it, or the half-life of D3 and its synthesis, it's approximately 48 hours and nothing more. So that annual supplementation really does no good. It's just a sitting duck and a sitting number. Okay. Quarterly supplementation, again, not so beneficial. Monthly supplementation, as you look at the graph, it shows quite extensive benefit. Daily supplementation sits up at the top of the entire chart. Weekly supplementation is equally sufficient. So generally, what we recommend is, a weekly supplementation of 60,000 nano oral solution or a capsule format is more than sufficient for most people. Preparations of D3, or what are the different formats of D3 that are available, and these preparations really matter. The quality matters a lot, especially if you're using it for therapy. It matters a lot. There are different types of formulations available in the market, which are oral and injectionable. Oral solutions are powder based, so you can have that granule powder which you can mix with milk and consume it, because vitamin D3 is fat soluble. So this is a good method of having it. There are formulations which are oil based. Okay, there is now what we call as the nanotechnology, which is the most efficient, and then there are oral sprays, and these all function quite wonderfully, as these can be used as per the recommendation of most of your physicians. Now there are also intramuscular injectionable. These are 6 lakh IU worth of injectionable solutions which are available when someone needs to be injected D3, because probably they need a much higher dose, or a loading dose as we call it, or a hammer dose. So there are injectionable preparations which are done intramuscularly. So facts and rationale in today's time. Vitamin D deficiency is a global pandemic. When checked first time without any supplementation, very low vitamin D3 levels were found in 90% of the population, between that 3 to 20 ngm. Nobody has been found with a minimum desired level of 40 to 50 ngml unless taking vitamin D supplements. Now we lose nothing by improving the global vitamin D status, as food does not have enough vitamin D. And correcting a deficiency is our duty, a responsibility, and an obligation. This is a message from Dr. Cesario Coimbra. Correction of any deficiency is an obligation, not a favor, and will not cause side effects, since one is just normalizing a biological parameter. Now, how many deaths will occur each day waiting for an attitude, or at least an alert or some kind of guidance? Now, in this slide, again, this is a simple representation of the correlation or the inverse relation of less D from sun plus less D from food is equal to less D in the body, is equal to more diseases. And what are these more diseases? Allergies, asthmas, back pain, cancers, cognitive decline, diabetes, hypertension, influenza, multiple sclerosis, obesity, pregnancy risk, rickets, TB, lupus, all are linked to vitamin D deficiency, my friends. So D for defense. It's high time to focus on the science of nutrition. The world will be grateful. Vitamin D is critical now for everyone.